interesting, Paul, and it will affect a lot of people. Thank you very much. Just a reminder, more on that story in Moneybox on BBC Radio 4 at midday.
It's coming up to 8 minutes to 9. Good morning. Studies show that the stress and pain experienced by very premature babies can go on to cause mental and physical illness later in life.
Now, Aberdeen Maternity Hospital is preparing to trial pioneering techniques that it hopes will reduce the chances of complications. Our correspondent Laura Goodwin has been to take a look.
Twins Willow and Neve were born at just 26 weeks, weighing a little over 2 pounds each. For their mum Zoe, the first few months of motherhood in the neonatal ward were bewildering and at times frightening.
I mean, it has been at times. I've thought one or two of my girls wasn't coming home. The past couple of weeks is when I've started to feel like a mum, because I can go and pick up my own baby. Like, you don't realise just how important that is until you can't do it.
Now, Aberdeen Neonatal Unit are trialling a new approach they hope will minimise the trauma of painful but necessary medical procedures for babies and to show parents how they can help.
You could be that other pair of hands and actually provide this kind of containment, right?
Friends of the neonatal unit raised £27,000 to bring Mary Coughlin, a neonatal expert from Boston, to pass on the techniques she has pioneered.
Two-person care is basically one person is doing the procedure and the other person's sole job is to make sure that the baby is comfortable. Now, the gold standard for the two-person approach is that other person, that comfort person, is the parent or a family member. There's lots of things that happen to these little people and their families that it's just an is thing, right? I mean, they're critically ill, they need the equipment, they need the procedures and stuff, but it's how we manage those experiences that can really reduce their short-term and long-term morbidity or complications as a result.
It's the smaller things, the littlest things make the biggest difference, like a parent just talking to their baby whilst they're having a painful procedure done. We might not have thought about it could be as simple as that. So really the parents being here and comforting their baby has been the huge eye-opener for us.
Baby Ella was born 8 weeks early. Her mum says empowering parents to help their babies is hugely important.
Because obviously you feel a bit helpless, like if they're crying, and originally she was in an incubator, so there's not much comforting you can do, so anything you can do to help her, you really want to do it.
Willow, Neve and Ella are all making good progress and will be heading home soon. Aberdeen Neonatal Unit hope adopting these new techniques will position them as a centre of excellence for neonatal care and ensure many more little miracles are given every chance to thrive. Laura Goodwin, BBC News.
Now we're talking